Status queries. Use the NIR status query to get information from NIR and populate a patient's immunisation history. For example, when a child enrolls with your practice that has previously been living elsewhere in New Zealand and has had immunisations. Choose the status query icon, the injection with the question mark, or you can choose the menu, module, immunisations and NIR status query. Enter as much information as you have about the patient and choose the NIR search button. This will then message to the NIR and return a result to the provider inbox within 3 to 10 minutes. You can choose the Find New Patient if you want to search for a different patient within Medtech and then find their details in NIR search that. You can also go to a non-Medtech patient tab to search for somebody that's not in your database already. A message will be returned to the provider inbox based on the match results. You can either have a status query single match, a status query result if multiple matches are found, or no match. A status query single match. If NIR can match the patients from the details submitted, then the single match will be returned to the provider inbox with immunisation records that can be used to update the patients. So for example, Maria Sanchez, this result's come back, it's matched with her, I'll pop her up on the palette. It's come back and said that she's a code B, preliminary newborn, and that we need to complete eligibility and enrolment process. We can click on the update icon and it will allow us to then update the immunisation details within her Medtech record. So the fact that she had the DTaP IPV 6-week given at 19th of February 2003 and also the second one here, the 3-month one. You can also see in this other tab you have the ability to update demographic information if you wanted to by selecting all and choosing to update. I'm not going to select those at the moment and just choose OK. So what happens now when we look at Maria Sanchez's record in the immunisation screen, F4, you can see that it's recorded and updated that she was given elsewhere in New Zealand that DTaP IPV 6-week and the DTaP IPV 2 to 3 months. In the provider inbox, if you get a status query result, this is returned if multiple matches found for the message that was sent off, and the user must select the most relevant one by clicking on search. So you can choose the most relevant one there with the date of birth, etc., and then do another NIR search. So if it can't find the exact result, it will give you choices. You choose the right one and choose NIR search, and then hopefully it will come back with a single match. The other alternative that you may get back into your provider inbox is you may get a no match if not enough criteria was found.